thank you for contacting Wave Support. From your clinical request, it sounds like this patient is experiencing very good vision with this new design, but is complaining of some awareness of the lens and reduced wearing time after a couple hours. From your request, it sounds like the patient is reporting a feeling of the lens all around. So if we look at your design, overall these designs actually look very nice, as you've got nice alignment in all the different meridians here. In most of these cases, from my experience, when people are talking about feeling the lens all around with reduced wearing time, quite often it'll come down to how that landing zone is interacting with the cornea. That's that blue to pink area. And I know your concern was that there might be a little bit too much edge standoff in the superior and inferior meridians. But if you recall, we kind of like a little extra standoff up there to promote tear exchange. So that may or may not be part of the problem. I suspect that you might just have lack of tear exchange in general. If you notice, this lens fits very nicely through here. Some patients will experience almost a little bit too tight of a fit in this blue to pink area, where that lens might also be hugging that cornea almost a little too much, almost like what I would refer to as the cookie cutter effect. And that little extra lens awareness will just sort of be too irritating over time. One thing to think about in this particular patient, with so much astigmatism, it's very likely in their old lenses that they're wearing either a spherical lens, which of course would be of a lot more tear exchange, or a toric lens in the past. And even if it was a toric lens, it's unlikely that it fits as closely to the cornea, the true cornea, as a wave lens would do. So what I found over the years is that quite often when patients have this type of complaint, it's really because the lenses are almost too snug in those areas. Even though they might look great in the topography, great on the wave design, sometimes we need to just get a little more tear exchange. I know you were inquiring about possibly switching to freeform. Freeform can also give obviously a little nicer, closer alignment with the eye, but in this case I suspect that freeform probably won't make that big of a difference. My recommendation would be to increase this clearance through this landing zone here by clicking up on the pink to get a couple clicks in there, and just kind of make sure you don't have any downturning meridians or downturning radii between that blue and the pink. Make sure they're not digging down in the cornea. Just bring that up a little bit more here. That would be one possibility. Another possibility is if you could possibly find out the approximate diameter of the prior lenses. Sometimes that will help you understand whether the patient is more comfortable in a very small diameter or a larger diameter. But quite often at a 9.8, you might be able to go a little bit larger, maybe to 10.2, get that landing zone to pick up a little bit more of the interaction in this outer cornea and get a little bit nicer alignment. From a material selection, the material you're using is a nice choice. However, sometimes if I'm concerned about awareness, comfort, or tear exchange, I might consider one of the tangible PEG coated materials. So I hope you find that helpful. I wish you well, and thank you for contacting Wave Support. Have a great day.